Well, welcome everyone. My name's Mark Harris. I'd like to welcome you to this webinar on Impact Project 2, which is on the ReAIM Realist systematic review of literature that we're doing as part of the project. I'd like to begin by acknowledging the Indigenous people of both Canada and Australia and to pay our respects to their elders past, present and future. This project is led by a core team, which we've got listed on the first slide. Simone DeRouge, Kevin Potty, Vivian Welsh, Sharon Parker, Carolyn Goday, Chadney Joshi, and myself. And there's also an increasing number of others involved from the LIPs in the reviews as they get implemented. This presentation, which if I can get the next slide to come on, it's not responding to my arrows for some reason. Okay. Oh, just slow. Sorry, it's I'll go back one. Will be by myself and Vivian and Carolyn. So in that order, we'll be handing over to each other. So we'll be covering the aims of the review and then talking about research question formation. We'll then talk about the logic model and the development of those to underpin the research questions that we'll be doing as part of the systematic review, and we'll then go on to talk about the protocol and the various steps and processes, and we'll have time at the end for you to answer, to ask any questions that you might have of us. So I'll move on to the next slide. Just there's a bit of a delay. So the aims of the review are to synthesize the evidence that organizational, system-level, community-based primary healthcare innovations improve access to appropriate care for vulnerable populations. So that's the purpose of what we're trying to do in Project 2, and we're interested in evidence for their reach, effectiveness, adoption, implementation and maintenance. And ultimately we're interested in how that is going to lead on to some the implementation of some trials in the LIPs. So if I move on to the next slide. So where does this project fit in as far as impact? Impact's a very large project which involves 4 main projects or programs of work, starting with some initial scoping review and survey of innovations, which has already been conducted and which has fed into both the process in the Learning Innovation Partnerships and into this Project 2. The Learning Innovation Partnerships are 6 local areas in which we have formed partnerships with local health service providers and health service managers and policymakers to identify priority strategies for addressing access by vulnerable populations. And the LIPs have completed that deliberative process, and we're using the outcomes of that process as the basis for our systematic review. So the LIPs are providing questions which we're working with and refining to conduct our systematic reviews. At the same time, there's another project, Project 3, which is focusing on analysis of existing national and international population surveys, and both of these projects are feeding into the planning process which the LIPs will be undertaking this year in the lead up to trials in each of the local innovation areas. So that's where Project 2 fits in. Waiting for the slide to respond. Carolyn, I think
yep,
it's not responding for some reason. Okay, so the next slide, I'm going to spend a little bit of time talking about this, is really an aid to the formation of some fairly clear and precise questions on innovations, about innovations that we might expect will lead to improvements in access to care by vulnerable populations. And so we're asking we have asked the LIPs to come up with questions, to first of all identify priority innovation that they're interested in ultimately putting into practice, and to really clearly define that question in terms of, first of all, the population that's being concerned. So which particular vulnerable population, or which what populations should be considered. A number of vulnerable populations have been identified as part of the study, ranging from people from low socioeconomic backgrounds, broadly defined, to specific population groups such as refugees or homeless people. So having some clarity around the population is important to know what literature we should be looking at. The next, of course, we want to understand what innovation the LIPs are interested in getting more evidence about from the literature. So we've attempted to provide some prompts to helping us to understand just what it is that we want to look at in the literature review, what kind of intervention. So the theory on which the intervention might be based, a number of, if that's known, there may be a theory related to a particular approach or the use of a particular provider or a particular intervention. The mechanism by which it influences outcomes, and it's really thinking about that which has led to us asking the LIPs to develop a logic model. And Vivian will be talking about that in a moment. So we'll sort of skip over that. And also a description of how it meets the definitions that were of the various terms that were defined early on in this project relating to what a vulnerable population is and how organisational interventions in particular should be described. So really all of that is about just describing the intervention. We then are asking the LIPs to, again for some clarity, to talk about what particular access component they're addressing, and I'll come back to that because the next slide will just refer back to that. That's the model that was developed by Jean-Fred Levesque and others, which describes both access from the point of view of the service providers and the services and of the population and consumers. The next element is that we would want the LIPs to describe in relation to their question is how the intervention relates to the typology of innovations identified in Project 1. So in Project 1, which was a scoping review, there's been a typology of innovations developed, and to the particular innovations which the LIPs are interested in, how do they relate to that typology? The next item, it relates to its context. So what's the healthcare context? What's the detail of the, particularly within the LIP, what is it about the way in which health services operate that's important? For example, is there a system for patients to be registered with primary care providers? That may be important to know in thinking about the way in which we do the review. And lastly, what are the outcomes? And again, I'm going to come back to that in a later slide. So if I can have the next slide, thanks. So this is just referring to the access model, which is from the paper by John Fred and myself and Grant a few years ago, and which identifies a kind of pathway, if you like, for patients, community members accessing healthcare services, starting from really identification of their needs and a desire to care through to using care and some of the consequences of using or not using care. And that those in the top row of boxes, we've got the elements of access from a service provider point of view, so how approachable the service is, how acceptable it is, the extent to which it's available and accommodates the population's needs, its affordability and appropriateness, and there's some examples of that. And these have also been used in the typology in Project 1. And across the bottom row, we've got the access from the perspective of the population. So there's a set of abilities there which really correspond to the access characteristics of the service providers. So the ability to perceive need, the ability to seek care, the ability to reach it, the ability to pay for it, and the ability to engage with care and care providers. So that's, we've asked the LIPs when they describe their interventions that are the sort of subject of their questions to really describe which elements of this access model it relates to. So if I could have the next slide. So I guess what's a little different in the reviews that we'll be doing is that we'll be using the RE-AIM framework as a framework for thinking about the impacts and outcomes of the intervention. So we've defined the population, we've defined the intervention, and now we've defined the context in which that occurs, and now we're defining the outcomes, and we're interested not just in effectiveness. Most systematic reviews that are conducted focus on, does an intervention produce a health gain of some sort, and effectiveness obviously is important and part of the framework of what we're looking at. But we're also interested in, clearly, especially when we're focused so much on access, in reach. So does it actually, does it reach the population that's disadvantaged, and how do we have adequate information in the studies that are part of the systematic review about that, about the characteristics of the population that wound up receiving the intervention. And then, of course, its effectiveness is the next step. But beyond effectiveness, we're interested in adoption. So has it been, particularly has it been adopted by health service providers, and what are the reasons for adoption or non-adoption? And that's critically important in terms of generalizability. We are conducting this in a number of different jurisdictions which have different systems of healthcare, and so it's very important that the LIPs understand the context in which this has occurred, and how the extent to which adoption has occurred across services and service providers, and some of the reasons for that. And the next element that we're interested in outcomes is in implementation. And in implementation, we're particularly interested in the costs of delivery to various groups, and also the extent to which it's clear that there was any changes to the original program. So how it was implemented is of interest to us. Often what is an innovation or intervention that's put in place is implemented in different ways in different locations. And lastly, what's its maintenance been? What's the long-term results across various subgroups, and what's been done to sustain the program results over time? Is there any information from the reported study about what's happened over the long term? So this approach to doing a systematic review is a little different from the standard one, as I said, which most of which focus on effectiveness, and so it's hopefully something that's going to be providing information which will be most relevant to the LIPs in designing their and planning their trials of innovations in a year's time. So I'll now hand over to Vivian, who's going to proceed with the presentation.
Okay, thanks, Mark. I think that, Carolyn, you gave me controls.
Yeah.
Okay.
Oh.
Oh, sorry, I went too fast. So my name's Vivian Welch, and working on this protocol development and logic model with Mark and Carolyn and the team. What I want to tell you a bit about is the logic model, and not to scare people, because I know this is not something everybody has experience doing. From the project from our perspective, what we thought is this logic model will help to make some of the assumptions explicit about the intervention and the context in which it's operating. So Carolyn has developed a very nice sort of how-to document on how to develop a logic model, and what we're proposing is that when the local innovation partnerships send in their questions to us, we will make an effort to formulate this logic model on the basis of the information they have provided, using the template that Mark has already shown about the elements of the question. And what we're looking at here is going from left to right, showing the process and the activities that go into producing the desired outcomes. So when we look at this logic model, the inputs are some of the things like human resources that are invested to make activities happen. The activities are the events or interventions that are done. And when we think about outputs, these are sort of tangible results that are produced immediately as a result of those activities. And when we start to think of the outcomes, the short term might be things like knowledge, and intermediate outcomes might be behavior, and long-term outcomes are those health outcomes and access outcomes that we are looking at. One of the things that is really helpful in these logic models is this idea of context, and we've been discussing some of the questions of the local innovation partnerships are very context specific and are based on the environment in which that local innovation partnership is situated, that has you know, a special relationship with its environment. So I think that's all I wanted to say about logic models. But so we're hoping this will be an iterative process with the local innovation partnerships to develop these logic models as part of the review process. Now I tried to change the slide. Sorry, Carolyn.
It's okay. I'll.
Okay. So just to give an example, and this is not a final logic model or a finalized question, but the Quebec Local Innovation Partnership asked a question about the effects of the use of a health service broker to increase the the acceptance and uptake of vulnerable populations by primary care practitioners. So what we did is Carolyn drafted a logic model based on the information provided to us, and what we'd like to do next is to have a conversation about whether this logic model adequately reflects the assumptions about the activities of a health service broker and the desired outcomes of a health service broker. So can I have the next slide? Thanks. So this may be a bit small on your screens, and I don't think we need to focus in on the details except to see the general format of this logic model is at the bottom we have some assumptions about what is a health service broker, that they might recognize social vulnerability, provide support, and increase the approachability of the healthcare system. And we also included a context box so we could describe the setting in which this is happening, where there is a central waiting list, and people can stay on this wait list for a long time. So the objective of the health service broker is really to accelerate the process through the waiting list, and also to provide some interim support that might help patients, especially vulnerable patients, to find primary care practitioners. Okay, so now it's going really fast. The Realist review protocol. I think that all of you have the protocol, and we don't want to spend too much time on the details. I think Mark has already described that we're framing this along the REAIM framework so that we can really think about the aspects of reach and adoption and implementation, and sort of when, where, and why it works. What I did think would be helpful to show you is these TIDieR and Progress Plus checklists that we hope will be used in conjunction with the logic model to help refine the questions. I think we don't have a very nice picture of how we hope this will be an iterative process, but certainly in the protocol what we describe is that the definition of the question is iterative, and we expect that the search will also be iterative. So we've described it as in consultation, because it's likely that we will need to look at gray literature and different program models that people are aware of. So let's see. Oh, okay. So the TIDieR checklist is a fairly recent development. I think it came out last year, and it's a tool for identifying components and aspects of an intervention to improve their documentation. And what we thought is this may also be helpful in defining the innovations of interest. When you look at this checklist, it has some elements about the rationale and theory of the intervention, and also the specific elements. So who provides it, how do they do it, how often, where does this intervention happen, and whether it's personalized and so on. Oh, I hear some nice music from someone. I don't know if it's possible to mute everyone. Okay, I think we lost the music. So that's the TIDieR checklist. And I think the next checklist is my last slide. Is something we call, it's an acronym. Carolyn, are you able to advance the slide? Sorry. Is the Progress Plus framework, which our group has used to identify characteristics of populations or individuals that that might be associated with health disadvantage or vulnerability. So this may be helpful in identifying the population, and especially I think for the work that we're doing with impact, some of the plus characteristics, things like features of a relationship, being out of school or having parents that are out of work, time-dependent relationships like being discharged from a hospital, and personal characteristics such as health status, multimorbidities, mental health. These are all characteristics which might be important in defining the population for these impact reviews. I think that's it, and I'm handing over to you, Carolyn.
Great, thank you, Vivian. So the next slide, so we thought we would present to you a bit the process related to the research question, and that would lead to the literature review. So you're seeing the sign-off process. Here you can see that there are three key players in this. So we have the Project 2 team, which is, and the actions related to the Project 2 team is in blue. So for example here, whoops. The LIP is in a purple, and the executive team, executive committee is in gray. So just bear in mind that this involves a lot of communication and a lot of back and forth between the Project 2 team and the LIPs. In reality, it is a complex process, but we tried here to simplify and streamline the process as much as possible to give you a good visual representation of what to expect. So the first step is the research question submission. So Dr. Harris presented the table with the various elements. So once you have all these elements and it's submitted to the Project 2 team, we will also ask that you provide all supporting documents that can help us get a sense of the intervention and also understand other elements like the context. So these supporting documents could be anything like key literature that you may have, program descriptions, even websites if program descriptions are not available, anything that can really help us to be able to complete this step. So also if you're able to present us with the written out question, that's good. If not, we will be able to make one with the elements you provided, and then we will ask you if it is accurate and if you can maybe, if it needs any changes. Afterwards, once we receive the research question submission with the supporting documents, we will circulate the documents to the Project 2 team so that everyone can familiarize themselves with the research question. We will then discuss this question and the elements at our next Impact Project 2 International Team meeting. So they happen approximately every 2 weeks. Following this discussion, if we require any additional information or any clarifications, we will then ask the LIPs to provide it back to us, and we will also provide feedback. Once we have all the information, so we send the question to the executive committee for sign-off, so right here. So because the executive committee is in charge of ensuring that the intervention is within the scope of impact. So we want them to be aware of the research question and to sign off on it. After this sign-off, then the Project 2 team will develop the review protocol as well as the logic model, for example, the one that Vivian presented relating to the research question by the Quebec LIP. So once we develop a protocol, we have the first iteration of the logic model, then we will send it back to the LIP in order for them to review it and then provide us with any comments or any changes that would be needed. So as you can imagine, there's a lot of back and forth that can happen that may not be represented completely in this sign-off process, but just keep in mind that it is there. And once the review protocol and the logic model is finalized, then we will send a summary to the executive committee for their consideration. And afterwards, we will start the literature review. All right, so what is needed from the LIPs? We need involvement from the LIPs at various levels and throughout the project too. We will not be able to complete this project without a lot of discussion and a lot of involvement. So first of all, of course, during the development of the research question as well as the logic model, a large part of this is done by the LIPs, and we know this is it can be lengthy. It's a difficult part to come up with a research question, but it is absolutely crucial that we spend the time that we need on this to ensure that we have a research question that is as accurate as possible. And with this, it will ensure that the rest will go smoothly. We will also require that the LIPs review the protocol. We ask that the LIPs provide us with a participant to add to the Project 2 team. This will ensure that the lines of communication will remain open and, of course, that the review remains centered on the needs of the LIP and remains useful. Next, of course, the LIPs will be involved with this, discussing the scope and, if necessary, to refine the question, helping the extraction. LIPs will review the preliminary tables and findings that we will have, and also any reports that we will come up with. Here we have the proposed timeline. So it assumes here that the research question has been developed. So it starts with the review protocol and ends with the publication. It spans over the course of about 12 months. So this timeline, we think it's fairly realistic, but we may have to tweak it or change it depending on our needs. So we allow approximately a month for the protocol development as well as the consultation and peer review. We should allow approximately 3 months for the study selection, 4 months for the review and synthesis, a month for the report production, 2 months for the consultation and peer review process, and 1 month for the publication. So this comes to the end of our presentation. I hope you are finding it useful, and we'll now open the lines for any questions, any comments that you may have. And so if anybody would like to ask a question, we welcome you.
Just saying, I'm linked up on the phone, so I haven't seen the slides, but.
Hello, I think, Teng, if you had a question, I think we missed the second half of that.
Yeah.
If people are having trouble communicating, you could type your questions in the little box at the bottom, the chat box. No questions?
Hi, sorry, this is Nilakshi from the Victorian LIP. I'm not sure if you can hear me. It's really loud. With the Victorian LIP, we've started talking to the management committee about what might go into the logic model. And given the presentation, that might not be the most appropriate way to go about it. But if it is, do you have any suggestions for how we might progress that discussion with them, or any tools that you could suggest that would help us have those discussions with them, knowing that they're not, and even we are not really across the idea of a logic model and how it should be put together?
Carolyn, do you want to respond to that?
Sorry, at the LIP level, you are discussing the logic model?
Yeah. She's asking, sorry to interrupt, she's asking whether there's any resources or some guidance that we can give them in discussing that with the health service managers, etc.
Right. There is the document that we have created here that we can definitely, we're going to circulate right after, so that could be something to start looking at. As well, there are other, it's quite a difficult process with the logic model, right? And we also give some references at the end. So we have the Kellogg Foundation logic model development. There's different guides that exist. There's a guide from the CDC. But I think maybe if you start looking at what we circulate, that can, and then you can definitely email me if you would like any more, if I can see if I can help even more with that.
That would be great. I think just having a look at the guide you have, and then maybe being able to touch base with you if there are any major questions would be really useful. Thank you,
Sure.
Carolyn.
Absolutely. You're welcome.
Yeah. There will be there's a reference at the end of this series of slides, which we'll come to in a little while, which is from CDC and the Kellogg Foundation. So those two references,
I'll actually put them
we could put up on the screen.
right.
Great. Thank you, Mark.
Okay, I think we had a question.
I think Simone's questioning about whether the timeline will be acceptable to people.
Right.
And asking the audience, I think, what they think about the idea of that kind of timeline. Really, I guess we're saying it's going to be about 9 months before before you see a kind of initial outcome in terms of reporting back from the review.
It's Grant here, Mark. Can you hear me? I'm just in a cab, so it may be a bit difficult. Hello?
Yes, we can hear you.
Okay, so I guess I'm asking on behalf of the LIPs, which is that we're going to be needing to design an evaluation and an intervention, or an intervention and an evaluation of that intervention. In a sense, with the results of this. I'd just be interested in any perspectives about how we can, in a sense, get started on those, maybe get started on the design of those things, how early we might be able to work with Project 2 to start putting it all together. And I know we haven't talked about this much at an international level, but I'd just be interested in your thoughts as to how much we can be getting a feel of what the results are before, in a sense, the final result, if you like. I'll just mute now. I hope that's clear.
Yeah, I think if I can start off and perhaps the others can come in, I think that it's really going to be, I think two things. One is I think the logic model actually helps, I think should help the LIPs in sort of thinking through a little bit more about their proposed intervention and how they might be wanting to evaluate it and so on. So hopefully that will be of assistance there, even before we start the review. The reviews, though, realistically, I think we're unlikely to be able to give very much back to the LIPs before inside of 6 months. I think that the reviews, the process of study selection and extraction and so on is going to take that about that time. Of course, there'll be a participant from the LIP in the review process for each of the review questions, but in terms of sort of the detail of how they might go about designing their intervention, I think I can't see how that's going to be really possible in much less than that sort of time frame. I don't know whether Vivian or Caroline's got a different view.
It's Vivian here. I agree with Mark. Yeah.
Me too, pretty
Carol?
much. Yes,
Yeah.
I agree too, as well.
Look, yes. Look, thank you. And I think that I really feel I'm sort of reassured by the logic model, and I think that making the LIPs focus around the model and trying to deconstruct what the intervention components are is actually an important way in people thinking on the ground as to how an intervention may well be framed, because that's the critical piece in impact is going to be funding these interventions. So thanks for that answer. That's really helpful.
There was a question on the in the chat box about when we wanted the logic models, and I think we want the questions as soon as possible, and the logic models, we're really aiming to get some clarification of those over the next month or so. So, but that we're anticipating, I think, as Vivian said, that will be that the development of the logic model is something that's very interactive, hopefully, between the Project 2 team and the LIP, so that we're not just going to expect that the LIP would be able to come up with a fully formed logic model on its own, where in fact I think what's happened with this Quebec logic model is that Caroline's developed that and fed that back to the LIP for their comment and further work. So, you know, we can do that providing we've got the detail in the question. We can even start the process. Again, Caroline, is that different to your understanding?
No, that's exactly it. And actually, it's we are. I haven't yet presented it to the Quebec LIP, so that's it's coming up. It's still a draft, right? We're still so.
Yeah.
Yes. But it's really close to being presented.
The question from Simone is, will there be an opportunity for refining the question based on the review that you do at the early stages? Certainly, and that's, I think if we went back, Carolyn, to the slide that had one of Vivian's slides about the 5 stages.
The 5 stages are...
Yeah, back and forward. So, back again.
There we go. This one? Or?
No, the next one, the one that starts with scoping the question, the 5 stages.
Yeah.
There we go.
There.
Yeah, exactly.
So that scoping review is the first dot point, and that is to look at just what's available in at least the the more accessible literature, largely the black literature, to say, is there a huge amount of information, and what we need to do is to narrow it down, or is there really practically nothing written, and we really need to reconsider our question to make it useful. So there's even though the executive has signed off, they're signing off to say that this kind of intervention and this sort of question is in scope. They're not signing off on the detail. And so we may, and I guess in an extreme situation, we may need to go back, go back to the LIPs and go back to the executive and start again if there's just no literature on the intervention that's being proposed. Again, Vivian, do you want to add to that?
Yeah, no, I agree with that. I think it's that search step where we would hope to refine the question. I think once we are happy with the the search, and I think it would be difficult to go back after reviewing studies, and synthesizing them to refine the question. But I think at the scoping stage, we certainly want to think about either narrowing down or focusing the question.
It's Grant here. Mark's raised an interesting point about the lack of evidence, if there is lack of evidence, and lack of evidence around proposed interventions. And I'd be interested in others' thoughts about this, but the primary aspect of Project 2 is wanting to be sure that we are proposing an intervention in which there isn't substantial evidence or reasons why that shouldn't be trialled. But by contrast, I think if there is something that where there's minimal information about either for or against, I hope that we can get a sense of whether it's worth innovating, because that's at the heart of impact. We're not fundamentally about, whilst the LIPs in themselves are innovative, we're not fundamentally about trying to just replay the past. We're trying to have a little bit of attention with discovering things that are new and are possible. So I'd be interested in thoughts about that. But there's lots of parts of this project where we've just got to take a deep breath. But Project 2 is very important about terms of just making sure that we're not going down roads that shouldn't be gone down.
Yeah, and I guess that's part of what we would see as, and ultimately that might come out of the final synthesis. It might be a decision by the LIP that so much of this has been tried and proven already that we don't want to go ahead with it, or that what we want to try and do is do something that's a variant on that. I think the converse thing, that there isn't much literature, what we may have to do is to broaden the question. So if we, for example, if we took a question like, what are innovations to using text messaging to improve people's registration with primary care, that might be an innovation. Now, we might find that there's almost nothing on that in the literature. And so the obvious thing to do would be to think more broadly about text messaging interventions, or to think more broadly about other kinds of interventions like text messaging that weren't just about text messaging. So that's a sort of way in which you might want to expand a review where there was no evidence. Where there's a lot of evidence, we might want to, we might find in the example that's already been given about brokerage from Quebec that there's just a mountain of evidence about that, and what we really are interested in is something a bit more specific. And that we'll try and do that in the review, but ultimately the review has to work with whatever evidence is there, and it will be up to the LIP to decide whether it wants to sort of just take the interventions as described in the review and try to implement them in their context, or to tweak them or to change them.
Thank you, Mark. It's Sarah here. I'm just conscious about the time. So I was just wondering if there's any final comments Project 2 team would like to add, or if there's a last question we can answer quickly.
I think we've kind of summarised it. I think one of the key things is that this is a conversation. It's not a one-way process, Project 2. So we very much want to engage with the LIPs. Great.
So thank you very much for being here today, everybody, and a special thanks for Mark, Vivian, and Caroline to put all of this together in a short time and being here today. So thank you, everybody.
Thank you very much.
Have a nice day.
Thank you, Sarah.
Thank you.
Thank you.
And thanks, presenters. Thank you. Bye-bye.
Yes.
Thank you.
Bye. Thanks.